Hello, my name's Jack Salmon, and I'm a professor of health policy and administration, and I'll be your instructor for HPA494 Comparative Health Systems. I've been at UIC since 1984, first as a professor of public policy analysis on the other side of campus. I've also been professor and head in the pharmacy administration department, and also a professor in the College of Medicine in the medical education department. I've taught health practitioner students for about 40 years now, very passionate about them getting to know health policy, the context of their practice, and also learning about the organization, financing, and delivery health care. My research has principally been in the US, but I've gotten interested in international health and had many experiences to start getting me interested in systems around the world. Like most Americans, I didn't venture off the North American continent until 1974, when I developed a wanderlust of travel through a tour of the health system in the People's Republic of China. I was a delegate of the U.S. People's-China Friendship Association, and that was right after President Nixon ended up signing the Shanghai Communique with Premier Zhou Enlai. That experience of the Chinese health system really strengthened my interest, not just in complementary and alternative medicines, but also in the phenomenal advances that the Chinese made in public health through a strengthened primary care system. And as you know from World Health Organization and even the discussions we're having with health reform here in the United States, primary care and public health interventions are really what's necessary to change health status of people. As a graduate student and then as a junior faculty member, in my involvement with the American Public Health Association led me to get to know many of the authors of the literature that I had read, beginning at my graduate school days in Cornell. And I became friends with many of these individuals, and they had great influence in my interest in international health. One person in particular, Professor Milton Romer, who had founded my program, my graduate program at Cornell, he became professor of public health at the School of Public Health at UCLA, and had been kind of like the dean of international public health in my mind, because he had traveled to many different countries, studied their healthcare system, knew all the policymakers, and wrote one of the books that we're going to be using in the course. He had a great influence in his analysis of the structures of healthcare systems and how they developed historically to be able to take learnings from those other systems and apply them to the United States. The literature on comparative health systems is somewhat difficult to get a hold of because it has not been fashionable for American academics to do a lot of writing about other systems. And you can notice from the discussions on health reform just recently during the Obama administration that we did not really see a lot of policymakers looking elsewhere, such as Japan, Canada, Germany, where we could have seen some models and not necessarily made some of the mistakes that we made. But this literature is there and available, and hopefully the course will give you a nice introduction to it. As you look through the course readings, I want you to be aware of the different years, because I've used some old literature and some new literature. I've also want you to be aware of the sources. Many of the chapters are taken from books that talk more extensively about subjects that you might want to probe into. And obviously, there are many other sources that you can find in the internet for ongoing policy debates and discussions. As you know, health, economic development, social development are very key topics in all circles around the world, and that is my expectation, is you're going to get into the course and do a lot of that searching on your own, particularly in the areas that you're most interested in. Again, I want you to use the course to develop what you really want to look at, and develop some expertise that's going to be useful for the rest of your graduate days here at the university. I've had the privilege of working with a number of international graduate students, and that's given me chances to study other countries, and it's been wonderful to write with different students and to get into some areas, particularly in the pharmaceutical area, that I would not have otherwise. I've also had the privilege, being an academic, to have a lifestyle of travel. This past year, I just visited the Kingdom of Jordan to give a keynote address at a pharmacy conference, and Jordan ended up being my 41st country of the world to visit. I've also had a chance to do healthcare study tours, which are open to health professionals, where organized professional groups take their members to look at countries and do more intensive experiences. Besides this healthcare study tour in China, with Professor Romer, I ended up going as a faculty advisor to American Medical Student Association tour of the Soviet Union, right at the time of Gorbachev and the Glasnost developments. I've been to Cuba with the University of Illinois study group. I've done my own tour of policymakers from Illinois to Canada, and I've also ended up visiting a number of other countries where I knew health professional friends and had chances to do some in-depth study of their systems. I've taught in Germany on a sabbatical, in Thailand, in Taiwan, and also in Sharjah, which is part of the United Arab Emirates. So I've had some experiences in Europe, Asia, and in the Middle East, and I also had a research project in South Africa, which I have a good deal of information about too. These have been wonderful experiences, which I'd love to see students have replicated in different ways. I have many friends all over the world who are always eager to share their insights with me, and I've learned a lot and found it fascinating. So whether you're an international student or planning to work in another country, I know there's a huge service intent by many public health students, or you just like to travel and you want to be aware of health and healthcare issues of populations that you observe. So I hope the course aids you in those kinds of ways and shapes your ability to understand the historical and the social, cultural, and political economic aspects of different societies and how they organize healthcare. I think it's very fine that you have an interest in this topic, and I'll be available as a resource, even though the online aspect of it doesn't give us as much contact. We will have some meeting times that will let us get to know each other, and we can always have coffee on days that I'm on campus and discuss your particular interests. So welcome to the course. I hope you enjoy it and find it worthwhile.